welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'm going to talk about people with autoimmune disease have a higher complication rate after heart attack study. After a heart attack, people with an autoimmune disease were more likely to die, develop heart failure, or have a second heart attack compared to people without an autoimmune disease, according to new research published in the Journal of the American Heart Association. Autoimmune diseases are known to increase risk of cardiovascular disease, likely due to multiple factors. People with an autoimmune disease have a higher prevalence of traditional cardiovascular risk factors, in addition to aspects of autoimmune disease that are also linked to higher cardiovascular risk and long-term use of steroid medications. The researchers identified 16,54,862 people in the US aged 65 and older in the Medicare Provider Analysis and Review or MedPAR file who were admitted to the hospital with a heart attack diagnosis between 2014 and 2019. Of those records, 3.6% had an inflammation-causing autoimmune disease noted in their charts within the previous year. The most common condition was rheumatoid arthritis, followed by systemic lupus, psoriasis, systemic sclerosis, and myositis or dermatomyositis. They found several important differences among people with versus without autoimmune disease who had heart attacks. People with an autoimmune disease were slightly younger. Average age was 77.1 years versus 77.6 years for those without an autoimmune disease. Most of those with an autoimmune disease were women. Those with autoimmune disease were more likely to have had a non-ST elevation myocardial infarction or NSTEMI heart attack, and they were less likely to have an ST elevation myocardial infarction or STEMI heart attack. The analysis found that people with an autoimmune disease were 15% more likely to die from any cause, 12% more likely to be hospitalized for heart failure, 8% more likely to have another heart attack, and 6% more likely to have an additional artery opening procedure. The researchers also found that people with an autoimmune disease were less likely to have heart catheterization to access narrowed coronary arteries or to undergo an artery opening procedure or bypass surgery regardless of the type of heart attack. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.